Now to an update on a critically important story the troubleshooters have been following for the past year.
A quirk in the Medicare system is causing thousands of families here in Connecticut and across the country emotional and financial hardship, and it all boils down to simply two words. Brad Drazen is here with the follow-up. Brad.
Well, it comes down to observation or admission. The way a patient is coded during a hospital stay may sound like a technicality, but it has an important impact on families and the entire Medicare system. That observation status was instituted to save the government unnecessary short-term expenditures, but it's being used by hospitals more and more in the past several years. And now one Connecticut lawmaker has prioritized making a simple change that could improve the entire system.
This is a hardship on a lot of families.
Nancy Renshaw of Bosra says her father-in-law Charlie was in the hospital for 5 days with breathing and heart problems. But at the time of discharge, they learned he'd never been admitted. Instead, Charlie was under observation status the entire time.
The most upsetting is that they do not tell you up front that this is going on.
Only admission status triggers Medicare for follow-on coverage, typically home health or nursing home care.
If it's medically prescribed by a doctor.
Today in Vernon, Congressman Joe Courtney talked about how this coding conundrum has impacted 600,000 families across the country. But he believes the solution is simple.
It's really about going back to the basic principles of Medicare that have been in play since the 1960s.
Courtney is championing a return to the so-called 3-day rule. When a person spends 3 days or more in the hospital, they should be considered admitted and qualify for additional care. According to the Center for Medicare Advocacy, the problem has escalated in the past 6 years.
The Centers for Medicare and Medicaid Services are saving money at the expense of people who actually qualify for Medicare coverage.
Congressman Courtney sponsored the same bill last year, but he's optimistic the new Congress will see stories like Charlie Renshaw's and take action to benefit both the individual patient and the nation's healthcare system as a whole.
Not getting people into a stable plan of care at time of discharge is almost a guarantee that you're going to see them back again in the hospital, and the system at the end of the day loses money with that scenario.
Later this week, Congressman Courtney, along with 20 lawmakers from both sides of the political aisle, will introduce the Improving Access to Medicare Coverage Act. The measure is receiving support from several of the major national physician and nursing associations. And Joe Courtney's optimistic it will continue to gain support in both the House and Senate. Of course, we'll follow the story and update you on the bill's progress. For the NBC Connecticut Troubleshooters, I'm